Fracture of the patella. Let's discuss in detail. This is a common injury and results from direct or indirect forces that occur on the knee joint. Now, when we talk about direct injury, that means any blow or any fall on the anterior aspect of the knee when the knee is flexed. As you can see here in the image, a direct fall over the patella. There might be a fall of an object over the patella, as in this case, or there may be a dashboard injury, which we have already discussed in detail in other conditions also. Now, indirect injury. In indirect injury, there is a sudden violent contraction of the quadricep in an unusual manner. The quadricep pulls the patella up while the patella tendon pulls it down, resulting in two patella being divided into almost two equal parts, one moving up with the quadricep tendon and other with the patella tendon, creating a gap in between, and this results into the two-part fracture of patella. Now, pathoanatomy. So this fracture, otherwise, if it is not a two-part fracture, is often remain undisplaced because of the intact pre-patellar expansions of the quadricep tendon and by the patellar reticulae. So here, as you can appreciate the anatomy, this is the patella at the center. Medially, laterally, it is surrounded by the reticulae, which are known as the medial and the lateral peduncle. At the lower end, there is a patellar tendon, and above we have the quadricep tendon and the suprapatellar region. Now, fracture remain undisplaced because of these structures which are surrounding the patella. Now, if the force of quadricep is very strong, it will pull the fragments apart as we have seen above, and it will result into the fracture of the patella as well as the rupture of the patellar reticulae. As you can appreciate in the image here, that with the fracture of the patella, there is also injury to the patellar reticulae both on the lateral side as well as the medial side. So this whole expansion, so this whole protective mechanism is being torn here. Types of fracture. It may be an undisplaced crack fracture. As you can appreciate, the patella is being fractured, but it is an undisplaced crack fracture. But it can also be a comminuted fracture. In that case, it is known as the stellate fracture. Now, patella can be fractured into different patterns. It is a transverse fracture. It is a fracture at the lower pole. It is a comminuted fracture, but this is undisplaced. Comminuted undisplaced fracture. Here we have a comminuted fracture which is displaced. The fragments are scattered in different directions. A vertical fracture line is present and the osteochondral. The osteochondral type is a type of patella that affects the cartilage and the bones at the bottom of the patella. Clinical features. If it is an undisplaced fracture, pain and swelling over the patella are the only clinical features. But if it is a displaced fracture, then bruises are present, which is a telltale sign of the direct trauma, direct injury. Something has been directly hit with a very high force on the region of patella. Pain and swelling. One may feel the gap between the fracture fragments. As you can see here, the patella is being divided into two equal parts and the doctor can palpate the gap, as you can see here. So it is a clear example of a two-part fracture. Crepitus is felt in comminuted fracture, and because of the rubbing of the fragments together, fracture fragments together, there is a crepitus. Hemarthrosis, which is the accumulation of blood inside the joint, and patient will not be able to actively extend the knee joint. There is an extension lag. Patient cannot fully extend the knee joint actively. X-ray. AP and lateral view are sufficient in most of the cases. As you can see here, this is an AP view and you can appreciate a fracture line here. It is being divided into two parts almost because the fracture line is running at the center. This is a lateral view where we can see how the patella is being fractured into two equal parts. A good example of the two-part fracture of patella. You can also appreciate the amount of swelling which is present here. Next, we have a skyline view, so known as the sunset view. It is taken especially in an undisplaced fracture, and this is the fracture line. This is how we can easily diagnose that this is a undisplaced fracture of patella. Treatment. So first is conservative treatment. In an undisplaced fracture, conservative treatment is sufficient. The aim of the treatment is relief of pain. So usually POP cylinder or the above knee POP cast are applied, and it is usually applied for 3 to 4 weeks. After that, the joint is mobilized But when we do the conservative treatment, one must make sure that the extensor mechanism should be intact. Extensor mechanism include quadriceps, patella tendon, and the soft tissues which are present around it. So they should be intact when we do the conservative treatment. Operative treatment. There are few situations where operative treatment is indicated. The situations are displaced fracture. Fracture fragments are moved apart. Then the operative treatment is recommended to bring it together with the help of wire or nails. Comminuted fracture, or in case of undisplaced fracture where the extensor mechanism is torn. Extensor mechanism, as we have discussed, quadricep, patella tendon. It also includes the soft tissues around the joint like the retinaculae, and because these structures are responsible for extending the knee and stabilizing the patellofemoral joint. So operative treatment includes the internal fixation. As you can see here, the joint is internally fixed here. Now most of the time it is fixed by using pins and wires. Here you can see the wire and pins are used. In a figure of 8 configuration tension band, this is the 8 shape, and tension band wiring is done. This figure of 8 band presses the two pieces together and creating a compressive forces. So healings occur at a very fast rate. Now other than that, screw fixation can also be done. As you can see here, these screws are applied in a cross direction, creating a compressive forces at the fracture site. That needs to be done is the extensor mechanism should also be repaired. The whole extensor mechanism, especially the retinaculae, if they are injured, as we have seen in the above images, that how the extensor retinaculae often gets injured or often gets ruptured. So if there is a rupture of the retinacula, then it needs to be corrected. It needs to be repaired. Knee can be mobilized early following operation, because one of the complications with this problem is stiffness of the joint. So early mobilization is important. Now next comes the excision of patella. There are certain conditions where excision is recommended. The first is the severe comminuted fracture, where we have different smaller fragments. So it's better to excise the patella instead of holding those small fragments together, because it is difficult to hold all of them together as the fragments are quite small. Next is if the patient is elderly and already have the osteoarthritis around the patellofemoral joint. Third, patellectomy with the repairing of extensor apparatus. So whenever patellectomy is done, the repairing of the extensor apparatus should be done, as it is important for stabilizing this joint. Usually after the excision of patella, immobilization is done for 4 to 6 weeks, which is around 1 to 1.5 months. Age is also an important factor. If the patient is less than 45 years of age, internal fixation is the treatment of choice. But if the patient is more than 45 years of age, then excision of patella is the treatment of choice. So as you can see here in these images, the patella is completely excised. No patella is present here. These are the different angle and views where we can see how the patella have been excised. Complications. The very first is the complication is the knee stiffness. As we have already discussed that after excision of patella, and otherwise also if the cast is applied, immobilization of around 3 to 4 weeks or 4 weeks to 6 weeks is done. So that will result into stiffness of a knee joint. So this is one of the complication. Second is extensor weakness. When we immobilize the knee joint, then the structure around the joint, especially the quadricep tendons, the quadricep, it often becomes weak. So quadricep weakness is very common. Other than that, inadequate repair of the extensor apparatus will also result into the weakness. Next is the patellofemoral osteoarthritis. Now as you can see here in the images, these are the different images taken at different interval of time. Here is the initiation of the patellofemoral osteoarthritis, initial changes occurring though the gap is quite maintained. But as the time passes, we can see how the changes occurs. The space between the femoral condyle and the patella is decreasing, and we can also appreciate the osteophytes formation in the area. And this is later on what happens, how the changes gets aggravate and patient complains of pain and other thing. Patellofemoral osteoarthritis results due to the changes that occurs following an injury or trauma. There might be damage to the articular cartilage which is present under the patella or where the patella sits on the femoral condyle. That will initiate the process of osteoarthritis and resulting into the patellofemoral osteoarthritis later on.